Hello everyone, you are all welcome to lecture number 1264, and today's topic is the chronic inflammation is the silent killer of human beings. It's a very serious issue. And why I have taken this topic, because there is a lot of medicinal chemistry involved and mainly protein chemistry in the form of cytokine cells, in the form of WBC, in the form of skin, a lot of organs, and their damage or injury or due to infection either by bacteria or virus. We get two type of inflammation. One is called acute inflammation. Acute inflammation means on the upper surface of skin, or maybe sometimes minor injury where you get swelling or some pain, and also some wrinkle on the skin. It can be recovered within few weeks or 1 month's time. That is called the acute inflammation. It's temporary. But when we are talking of chronic inflammation, it continues for years inside, just like terrorist inside our body and damaging lot of our normal cells and all organs, and we are not aware of it, and that's why we call it silent killer. And why I have taken this topic, because I have gone through a lot of recent publications which are published by even Harvard, and also very by British School of Medicine, and also in Washington, lot of research institutes, they have published the paper. So in that paper now they have concluded that our 75% death, is because of chronic inflammation. So most of the health issues are linked to chronic inflammation, and we are not aware. Scientifically, we don't understand what is going on inside and how silently chronic inflammation is killing us. So first thing, I will discuss one case recently. In one Indian company, recently it happened, one young girl of 26-year-old, and the company name is given Ernst Young Company, that is EY company, in India. Last 26-year-old Miss Anna says Sebastian. So when she got the chronic heart attack, Miss Anna Sebastian, in that EY Indian company, and when investigation was done, they concluded that it is because of overwork, it is because of stress, it is because of not sleeping, and due to this stress and overwork was the reason. But when the research was conducted now, it was found that she was having chronic inflammation for many years, and she could not understand that. And that is not the only case. There are many young people, male and female, today they are dying globally because of such type of chronic inflammation, and we fail to understand. We are saying that it is because of stress, strain, overwork, and also because of some other pollutant, smoke, so many factors. But they fail to understand that it is because of prolonged for many years, suffering from chronic inflammation inside, and we fail to understand. So what is happening in that chronic inflammation? There are symptoms, there are reasons, and it has lot of protein chemistry involved. For example, if suppose your hand is focused to steam, you will get burning sensation. You will get pain. Or if suppose I am hitting here several times like this, you will get some red color here, and there will be pain. There will be itching. So this pain and itching, if anybody is bombarding you or beating you, or you are hit somewhere to the wall, or you fell down, you get some injury, immediately you will get two things. First, there will be swelling, and there will be some reddish color change, and you will get burning as well as pain. So the chemistry behind is that once there is any type of attack on your body where you get first, that is called acute inflammation, is because your cells and muscle cells, they are broken, and that is called microparticles. And that microparticles, when it is there and blood vessels are there, and they will be we can say little bit active, and the elasticity will be relaxed, so that more supply of blood should be there to attend the emergency. And where these particles which are already damaged, micro damaged particles, are not getting enough blood, and that is causing the burning sensation and pain. So that is the first starting point where to identify and understand that once any type of damaged cells are there in our body anywhere, immediately there will be sensation, there will be pain, there will be burning, there will be itching, and immediately there will be rush by the blood, and two type of proteins are involved. One is called WBC, I call it soldiers of the blood, and second is cytokine protein. They are also there to cover all the information is sent to our brain that what is happening. So these two cells, they will immediately rush, and that's why there will be little bit swelling and reddish color, because overflow of blood will be there. So here I am giving you this. I have written some main point, and I will be discussing one by one. Number one, Ernest, a young company, that is EI, Ernest Young Company, the name is, it is in India. Last 26-year-old employee named Anna Sebastian by chronic heart attack. Because of, they mentioned that it is because of stress, overwork, BP, blood pressure, all these factors of work, but no, it was found that it was not because of that, rather she was suffering from chronic inflammation for many years, and she could not understand that. And not only that, 90% people, they don't understand, they don't care, and they are not aware of it. There is no awareness of the meaning of chronic inflammation in the body, and we will be suffering. We will be having lot of signs and symptoms, but still we will fail to understand. So I am going to discuss it very detailed, because I have gone through the different papers, John Hopkins latest paper, then MIT latest paper, British Medical Association, medicinal chemistry. So one by one I am going to clear. Please try to understand the silent killer of 75 to 80% people on this earth is nothing but chronic inflammation. Try to understand the chemistry and protein of chronic inflammation. So number two, heart attack. These are all we can say health conditions we are facing. Heart attack, heart blockage, formation of plaque, Alzheimer's, Parkinson's, diabetes, cancer, deaths are because of chronic inflammation, and 75% of our deaths, 75 to 80% are because of chronic inflammation. Number 3, the silent killer, chronic inflammation, gives indications and symptoms. So what are these indications and symptoms? For many years, but due to lack of scientific knowledge and awareness, we do not give attention to this silent killer, chronic inflammation. The the signals or symptoms are mouth ulcer, that is weight loss without reason, poor skin look, your skin will be loose and it will be, you are young but you will, for example, you are 25-year-old but you will look like 50 or 60-year-old, your appearance will be dull and old, you are always suffering from fatigue and always in depression, always in anxiety, always in some unhealthy condition. All these are nothing but due to you are suffering from chronic inflammation. And you can look and wrinkles on the faces, different type of skin problem, they are all actually starting point, that is called acute inflammation. And then inside your body, I call the silent killer terrorist, that is called chronic inflammation. So here, with this I will stop and I will continue on this at least 2-3 lectures, because some factors and then some remedy, some lifestyle changes, how to recover from chronic inflammation. So with this I will stop. Thank you very much for watching the lecture.